Blockchain is often described as a disruptive technology, but in the case of healthcare, it has the power to alleviate major challenges. And VitalHub is leading this transformative union. Let's welcome the President and CEO of VitalHub, Dan Matlow. Dan, welcome to SmallCapPower.
Thank you. Thanks for having me today.
So why introduce blockchain into the healthcare space? What challenges can it overcome?
Simultaneously, we started combining a couple mental health-based organizations, and we clearly saw that the concept of interoperability of mental health records for patients was a challenge, and many of our clients were suggesting it was a challenge, and we're looking for those solutions that would do that. So we put a small team together and started looking at innovative technologies, and then started exploring blockchain to see what it could do. And clearly, we just became more interested in what that aspect could do for our particular clients and the business. We then explored what technologies were out there, and we picked something called the Hyperledger platform, which is run by the IBM. It's an open source consortium, a group that was affiliated with it. I think there's like 250 different organizations that are involved with that particular technology. We picked it and then started working with it to conquer the problem of sharing mental health records. The blockchain represents the ability to get a secure platform that can move it between hospitals, community health, individual practitioners, psychiatrists, et cetera, and get better care. So having a mental health record at fingertips saves a lot of time. It takes a long time to assess and diagnose a mental health patient. So this speeds up that reaction time, which is going to save time, save beds in particular hospitals, save admission times, help streamline emergency rooms, many different aspects to do that. So we embarked on a project in Southern Ontario with the community health organization and hospital, Blue Water Health in Sarnia, where we're doing interoperability of that mental health record, and we're looking to go live with that particular implementation very soon.
Okay. Your growth model is based on mergers and acquisitions. Why adopt this model, and how is it working for you?
Yeah, healthcare, we have a lot of experience in the healthcare arena. I've been doing healthcare-based software since the mid-90s, had a predecessor company, MedWorks, that was involved in the Canadian space, international prior to this. And we've come across a lot of smaller organizations that we believe that combined bring benefits to the owners of those particular organizations, to the customers by getting some critical mass, and to our shareholders, because there's good opportunities for synergistic value in many different ways to do that. So we've embarked on, we just announced another acquisition last week, Roxy Software, a small little one. So we're 5 different companies that merged together, and we've embarked on integrating those base companies, and we've done a good job at that, and we're starting to really see the results that have come of it, and we're looking to do more.
Okay. A big part of your acquisition strategy is also investing in the commercialization of the product. What do you do there?
Yeah, commercialize. We think a lot of these companies have been sole proprietors, smaller-based, technology-based companies that haven't put a big emphasis on commercialization or growth through an effective sales and marketing strategy. So we've ramped up a sales group, we've ramped up our websites, our marketing efforts, and we've also started approaching to start doing larger deals. So we have experience in our sales group of provincial level deals, regional level deals. So as opposed to going to the small individual organizations, we're really targeting those larger deals, and we're excited about what that pipeline looks like right now. We're starting to see procurements that are getting recognized in the millions of dollars versus the tens of thousands of dollars, and we're hoping that we can start getting those in the near future.
Okay. You've also brought in an offshore development program, and that's to build up the acquisitions that you've made. What is that about?
One of the first acquisitions was B-Sharp. B-Sharp had an offshore development group based in Sri Lanka. We've ramped up that team from 24 up to 35 people now in that particular group. For sure, there's cost synergistic values in terms of cost of labor there versus here, but we really developed a really good, strong expertise. It's really healthcare-centric based group. The core group has been together for about 8 to 10 years of build that, so we've built some knowledge, some expertise. It's a really nice foundation that understands healthcare-based applications. So as we make acquisitions, it allows us to get some cost savings potentially in that, not all the time, and to build newer products using a cost-effective based development group. So we've worked hard the last 4 months of integrating those companies, with Sri Lanka being a key component of that, and it's going really well.
And Dan, lastly, what's your vision for VitalHub, and how do you plan to build shareholder value?
Putting all the pillars together. So M&A is for sure a component of that. We think we can get some cost effectiveness through M&A, get some cost synergistic value, which is going to get returns to the shareholders in terms of increased revenue and profits. We also know that we need growth. Growth is going to come through two levels. One is just through acquisitions by bolting on things, but we also want to grow organically. WellLink is a particular example of that in the blockchain side that has opportunity for growth. We also think there's opportunity just in doing a better job of commercializing those assets that we have. So you're going to see it coming through innovative-based products such as WellLink, which adds that, innovative products which add to our install base, and just doing a better job of getting larger deals of the particular technologies we have. So we want to go on all cylinders, cost reduction, growth through acquisitions, and growth through organic growth. And so far to date, we've done that by, we've gone from 0 to close to 10 million in revenue in the first year, and we plan to continue that in a pretty aggressive fashion, and we're on the right track to do that.
Dan, wish you the best with VitalHub. Thank you for your time.
No, thank you for having me.